Hi, this is your Houston chiropractor, Dr. Gregory Johnson. We have Gail back in here with us today. This is Gail's second visit here this week. She used to live in Houston and be a former patient of ours. Then they moved down to Naples, Florida, and she's been having severe migraine headaches now for how long?
10 years.
10 years, and you've been seeing a neurologist down there, and you really haven't gotten any better with any of the doctors you've seen down there, right?
No, I have not.
And that's why you and your husband decided to fly back here to Houston to get chiropractic care here, right?
That's right. You're the only one that helps.
It's the only one that's been able to help you so far? Yeah. Okay, well, let's show them how we do that. Okay. I'm going to have you close your eyes and flex your head forward and backwards for me. And then neutral. Yep, see, you're still just a little forward and right. You're still side sleeping it, aren't you?
Yes.
Okay, I can always tell. All right, here we go. Let's go ahead and lay you on your back first with your butt right here. All you crack addicts are gonna love Gail. She's really crunchy. Yesterday, or what was it, Tuesday?
Yesterday.
Was it yesterday? Adjusted you, and we got a lot of separation between your occiput and atlas and reseated those. And you said your migraine felt a little better since then.
Yes.
Migraine headaches are tough. I went ahead and ordered an MRI on her brain just to rule out any pathology there. I've already done the vascular George's test on her to rule out any atherosclerosis or carotid artery problems before I adjusted her cervical spine. There we go. There, now lay it back. Okay, just breathe on. Just like that. Yes, ma'am. Felt that all the way down, didn't you?
Oh, yeah.
Yeah. Okay, tilt your right ear, or left ear to your left shoulder. Oh yeah. Right ear, right shoulder. Perfect. Got your Atlas NC2 on that. That should give you some pretty immediate relief right there.
Yeah.
Okay, let's come over here on this table now on your tummy. Get up sideways, remember? Yep. Alright, we're going to lay you on your tummy there. Your hubby already headed back to Naples to work. You stay here to get well.
Yeah, I did.
Legs are even today. That's a good start. And they stay, well, the right one gets a little shorter. Does that tighten up a little bit?
Yes, it does, definitely.
I adjust the entire body, not just a specific bone in the spine, because all 24 freely movable vertebrae throughout the spine and the 3 pelvic bones, they all work in kinetic chain correlation with each other. So if you don't line up the pelvis and low back, the neck's not going to stay. If you don't line up the cervical spine, the low back's not going to stay. So that's why I adjust everything. There you go. Okay, let's turn you on your back. Yes, ma'am. Now I'm trying to bring her whole head up over her spine. See, her ears back here over her shoulder now, which is where it's supposed to be. Slide down this way a little bit, Gail. Straight down. Now put your arms out to the side for me, face up. There. Yes, ma'am. You can relax your hands on your tummy now. That is. Feel that all the way up?
Yeah.
Okay. Perfect.
Oh, that one's
Good job.
really good.
Yes, ma'am. You let go of that one a little bit better. Let's
Yeah.
sit you up, face that away now. There we go. Okay. There. That's a girl. You know, the thing about neurologists and medical doctors diagnosing and treating conditions such as headaches, whether they be migraines or tension or cluster or cervicogenic, and you can share this too. Most of the time they just do tests on you and diagnose you and then give you pills,
Right,
medications.
yes.
And that hasn't really done anything for you, has it?
No, not much. It just has masked the pain.
Right.
And this last round has been it's been an entire month and nothing has helped. No pills or medication has helped at all.
Right.
And this is,
And that's what chiropractic differs so much in, because we're actually correcting biomechanical and structural abnormalities, what we call vertebral subluxation complex of the spine, realigning those bones into a better biomechanical relationship with the adjacent vertebrae so that the patient's nervous system can function at a higher level of efficiency or more normal. And it affects the autonomic nervous system, the peripheral nervous system, and also the brain and spinal cord function. So I'm not treating her for her migraine headaches. I'm actually treating her for her cervical subluxations that can be affiliated with or possibly the underlying cause of her migraine headaches. And I'm not saying that that is, but it's relieving some of your pain when you get adjusted, so that tells me that it is cervicogenic and it's because your vertebrae misaligned.
right.
Does your headache feel a little better right now, this
Yeah.
moment?
Yes, it does, definitely.
Good, good. Let's stand over here.
Okay.
Okay.
Oh, I do have mascara.
That's all right. Let's have you flex. That's what that paper's for. Let's have you flex forward and backwards again. Now I do adjust the atlas with this atlas specific adjusting instrument too while the patient's in their biomechanical mirror image. So she's a little forward and was right. Now she's more centered right now. Do you see that?
Mm-hmm.
But we are going to have her pull her shoulders up and back, flare these hands backwards where the palms are forward. And then see, I'm going to bring her straight back in the Z-axis first. Then we're going to look back at the wall in the X-axis rotation. I'm adjusting her atlas, which sends a neurological proprioceptive afferent input into the cerebellum. The cerebellum controls balance, posture, coordination, and all kinesthetic movement. So all y'all that keep asking, well, what does that gun thingy do? I'm adjusting her atlas transverse process. It reverberates around with the occiput and C2 and resettles and takes the pressure off the occipital atlas nerve and also the C1, C2 nerves, which go up into the brain. So when we do this adjustment, we're actually retraining her cerebellum how to hold her in this position rather than the out of place position, but you can't hold your hands out in front of you. Okay, now let's have you flex forward and backwards for me again. Well, that should have felt smoother to you.
Oh yeah, definitely.
Yep, take
Yep.
a look, you're right down the middle.
Yep.
So you came all the way back here to Houston from Florida to get your treatment. There's people all over the world watching these. They want to know, is it really worth that much? I mean, is it
Oh yeah, definitely.
is it worth the trip and the money to come here?
Oh,
Because we
yeah.
don't do insurance at all.
Right. No, it's worth it. Definitely.
So if you suffer from spine-related disorders such as vertebral subluxation complex or biomechanical problems, neck pain, back pain, shoulder pain, migraine headaches, tension headaches, chiropractic could be a very viable alternative for you rather than taking medication all the time that just hides the symptoms. So we're gonna have Gail come back whenever she feels like she needs to. She knows what it's like to be in place versus out of place now, so
Oh yeah, definitely.
she can make those decisions. This is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief in Houston, Texas. We'll see y'all soon.